Doors closing.
If you look at life expectancy in the Loop, it's 85.
But you go down the blue line and life expectancy in Garfield Park plummets to 69. And in that short distance between the Loop and Garfield Park area, you have this great gap, 16 years.
When in time was the average life expectancy 69 in the United States? And it's almost like one is going back in time when you look at healthcare availability. I know that some will look at this and think it's all violence. It's just not all violence at all. It's cancer outcomes, it's heart disease outcomes, it's infant mortality from causes unrelated to violence. It's all of these other things.
Growing up, living on the West Side, investment after the late after the late 60s or early 70s really kind of went down in the neighborhood. And I think if we can revitalize that, investment is extremely key.
As an anchor institution, partnered with other anchor institutions on Chicago's West Side, and including partnerships with community leaders and community-based organizations, we're taking a whole new approach to addressing historical inequities on Chicago's West Side, including the social and structural determinants of health, things like structural racism, poverty, and educational gaps. We're calling this new approach West Side United.
In this initiative, they've done a great job so far in being very community focused and looking for input from community members and asking community members and providers to be a driving force.
We don't have all the answers. This is an opportunity for you all to tell us what's really happening.
Just as I read this, I got excited.
We should come together as a community.
Make it easier for us to find a job, even if it's like making easy money. It's better than making like bad money, like by selling drugs and stuff.
This is one of the things that in our church is basically what we're doing. We're about the community.
What do the check-ins look like to see that we are really on the same page and moving toward the same direction?
Para mí esto es un reto, pero también es una oportunidad de poder ser la voz de muchos de nuestros residentes que no pueden expresarse. Y para mí es también un orgullo ser parte de este comité para poder mejorar la vida de los residentes.
That's what the partnering is all about. It's a bunch of people, institutions, community-based organizations, faith-based organizations, all coming together and having like the same goals and the same strategies to help make life better for people on the West Side.
And our focus is not just health outcomes, although that is such a major portion of our focus is health outcomes, but we're branching out and we're looking for other areas where we can have impact and make a difference.
I'm really excited about the work we can do in the next 5 years in beginning to bring in healthcare services into our neighborhoods, whether that's integration and co-location of primary and behavioral healthcare services into community providers and schools in our neighborhoods, or whether it's peer-to-peer education between community members to other community members in areas of early childhood education, violence prevention, healthcare access.
What's really at stake is the long-term commitment to the communities and the people of the West Side, and this is the population that we serve every day.
A lot of the individuals that we work with that were our clients are my employees now. And they are changing what their community looks like because they see what their possibilities are. And they can show the folks who are walking through the doors now what their possibilities are as well. So that's what I see.
We need a commitment. And not just a short-term commitment. We need a long-term commitment. We need everyone to ask themselves, what can I do? Next thing, there needs to be a contribution. People feel like we're talking financial contributions, but we're not just talking financial contributions. We're talking about time, talent, resources. What contribution can you make? And everyone has a contribution to make. And finally, a willingness to work, a willingness to roll up our sleeves and get dirty and do the work. You know, we need that time, the talent, the resources, the commitment, but we need that willingness for everyone to come together and really work to succeed.